Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy. And did you know kids aren't the only people that need ear tubes? We often put ear tubes in adults for many of the same problems that children need ear tubes for. Children are more prone to need ear tubes because the eustachian tube, which is the natural drainage system for our ear that lets air under our eardrums, often the eustachian tube is small and angled differently in young children, so they're more prone to have problems. But adults can also have problems with the eustachian tube. There can be anything from swelling in the eustachian tube, from allergies and sinus problems, or adults just never grew a large enough eustachian tube as they got older and are constantly prone to having ear infections. So in adults that have fluid in their ears or ear infections, or sometimes when they just have what's called retraction, where the eardrum is collapsed a little bit or is pulled in too much towards the inside wall of the middle ear, we may need to put ear tubes in. The procedure to put ear tubes in adults is actually quite simpler than it is in children because adults can hold still and we don't have to have them under any general anesthesia. We simply put some eardrops on the eardrum that burn for just a few seconds, but it deadens that portion of the eardrum. We make a small incision in the eardrum, we release the pressure, we suck out any fluid that's there, and then we put a tube to actually hold that hole open. So an ear tube's job is actually to allow a little opening in the eardrum. It's kind of stenting open a hole in the eardrum so that the hole doesn't close prematurely. Ear tubes last about anywhere from 8 to 12 to 24 months depending upon what style of tube is used. So if you're an adult that has chronic ear fluid or recurring ear infections or just a collapsed eardrum that's affecting your hearing, you may benefit from an ear tube. It's actually quite simple procedure, takes about 5 to 10 minutes, done during most office visits if necessary. I'm placing an ear tube in a patient that's awake in the office. I'm applying phenol to the front section of the right eardrum. The white area is where the phenol has blanched the eardrum. This eardrum's very retracted down to the promontory, but I do not see a middle ear effusion or fluid. Now I'm going to take a myringotomy knife and make a small incision in the eardrum. The patient doesn't feel this because this area has been numbed by the phenol drop. Once I've made an adequate incision, I'll then apply suction to the myringotomy site to make sure that there's no effusion or fluid. Now we're looking through the opening into the middle ear. There's the suction. No fluid was present in this ear. Now I'm going to place the tube. I'm using a bright blue tube. This is called a Tuma T-tube. It has a T-like flange. I'm fitting the lower flange in through the myringotomy site. I'll then use an instrument called a pick to then position the lower flange or the upper flange in. And now that tube's in good position and we're looking through the opening into the middle ear. How bad was that?
That wasn't bad.
Wasn't bad? Can you tell any change in hearing yet? You may not be able to, but
yes, I have.
You can see a change. So, hope that helps. Again, Dr. Brian Heaberlin here with Lexington ENT and Allergy. We're happy to take care of your ear, nose, and throat issues, such as ear tube placements in adults or anybody else here in the office. Thank you.